minutes of exercise could provide relief to those suffering with depression. Dr. Reena Mehta from Uptown Allergy and Asthma joins us now to explain. Good morning. How are you?
Good. How are you? Good morning.
I'm doing well. So this is certainly something that's super interesting and something that I feel like I can personally attest to. I mean, exercise always makes you feel good. I think that's something that everyone understands. But this is a study that has kind of shown this to be true. Tell us about it.
Yeah, so I mean, depression is quite common. 1 in 10 adults suffer from depression, and so it's not for the rare. A lot of people do have depression. So this recent study that was published in Psychology of Sport and Exercise looked at people with major depressive disorder. And what they were looking at was, are there other interventions other than just medications and therapy that might help these people who suffer from depression? And so what they did was they enrolled these people in a study where they did moderate intensity cycling for 30 minutes. And they had them take surveys before the cycling, during, midway through cycling, and for 25 minutes, 50 minutes, and 75 minutes after the cycling. And what they found was that the majority of people who suffer from major depressive disorder noted an improvement up to 75 minutes after post-exercise, that they had improved mood, improved depressive state, and they had the ability to engage in activities that they previously found pleasurable that they previously couldn't do.
Wow, I mean, that's absolutely fascinating, especially to think that it's simply 30 minutes, because it seems like something that most people can find within their day. And, you know, I was saying, you know, how this kind of speaks to me. I went running last night, and, you know, not necessarily to cure any sort of depression, but it makes you feel good. So it's that sort of like endorphins. Is that maybe what's kind of helping out with everything?
So exercises allows the relief of your release of your happy hormones, otherwise known as your endorphins. And so what was so cool about this study is that they found that these patients did better 75 minutes even after exercise. So I mean, there's some sustainment of their improved mood. And so the thought is that maybe immediately post-exercise, people who have major depression can engage in emotionally challenging tasks, maybe meeting with their therapist or their psychiatrist during that time, because maybe they would actually have even more of an improvement and work on their depression even better if they exercise right immediately prior.
Yeah, that's certainly an interesting hypothesis, to think that, you know, you could use exercise as a tool in fighting depression and kind of tackling those things that are even harder to do, you know, maybe for some folks on a daily basis. What are the next steps for someone like this, you know, maybe someone who wants to try and utilize this as a method to fight depression?
So, I mean, I think it would be really important to talk to your therapist or your psychiatrist, because the patients in the study also reported that they felt a stronger connection with their therapists and their doctors after this experiment. And so really, if you can kind of talk to your mental health care provider, obviously, this isn't saying, okay, don't take your medications or don't continue your behavioral therapy, but this is saying, in addition to that, if you can, you know, get motivated enough to get to the level of moderate intensity exercise, 30 minutes a day, not a lot of time, you can actually use this as a tool to kind of handle other emotionally challenging tasks throughout the day, and it could probably help your depression because it improves the release of these endorphins.
What a really great study, really fascinating. It's something that I'm sure can help a lot of people, and, you know, and also remove that stigma. You say 1 in 10 adults suffer from depression. You know, maybe this is something that can help you. And even if you're not someone who suffers from depression, a little exercise never hurts. Thanks so much for joining us this morning.